Hello, everybody. Um, my name is Zane. Let's see if this is on. Okay. My name is Zane. I'm doing um, a presentation here to try to help your family, whether it be your grandmother, your grandfather, your dad, or anybody else, your uncle, how to help you be a caregiver, basically, and to deal with all the situations that comes with it. Being a caregiver to your own family or somebody else, perhaps. I've done this for 4 years, doing caregiving, not as a profession to get paid for it, but I did take care of my grandmother for 4 years, okay? So I do have a good bit of experience in this matter. And I highly recommend you to watch this entire video. I know I might be going slow and whatnot, but the fine details matter tremendously in this job while you're doing it. So every little bit counts tremendously when you're taking care of your grandmother or grandpa, etc. Okay? Now I'm going to have several video cameras set up. I have two now recording, but I'll also wear a hat, and I have like a makeshift video camera extending downward from my hat. Okay. Now, there's several stages in taking care of a person as they decline downwards. So, in the beginning, you'll be more proactive in the daily process and everything. And towards the end, when they're getting more near to pass away, as my grandmother eventually did after the 4 years went by, it'll be more of a slower process, although it can be just as strenuous. Again, I need to warn everybody that what you do to watch these videos, and if you decide to use them, if you feel it's right for you to use the methods that I explain in these videos, is on you. I am not a professional nurse. I am not a professional caregiver or doctor or any of the like. I'm not a medical professional. But I do have experience, and if you want to learn the experience that I've had and the methods that I use, it is at your own discretion, and it is your free will whether you want to use them or not. But I do not claim to be a medical professional, and I would like to help you, but it's up to you. If you do not trust what I am doing, then do not do it. Only if you feel you need to use this method or these methods that I use, then you can decide whether it's right for you or not. But I will not be held responsible if you do not do things right according to what I'm telling you or anything else. You do this all at your own risk if you decide to choose to try what I've done and what has proven to work for me many times over as the methods to use. It is up to you. You do it at your own risk, and I'm sorry I repeat myself, but I'm just making that very nice and clear. With that said, I believe I do have good methods to use that I personally learned in the process. I've done it for 4 years. I took care of my grandmother. I did not receive any help other than eventually hospice people showing up, and that was just like usually more along the lines of the RNs or LPNs. I did not have any caregivers come help me out or anything like that. And actually, for the most part, not to boast, I did most of it on my own. They just kind of checked her up and wrote the reports, and she needed the medicine and she could not make it to the doctors anymore. Okay? At a certain point. And they did help me out. I'm not knocking the professionals. They did help me out tremendously, as far as, especially towards the end, giving her a pill because of her mucus when she was going to pass away. I'm not knocking their methods that they use, although I believe their methods are a lot harder on the caregiver and the patient. And I did not use their methods predominantly when I did my own doings of taking care of my grandmother. With that said, you'll need a lot of tools in the so-called tool chest. You'll need many things to do this job. It's doable, certainly, to do this job, but you'll need the tools and the methods to use taking care of your grandmother or whoever, like it was for me. I took care of my grandmother for 4 years, okay? I'm not in a rush because there's many things to cover, and I'm trying to do this as detailed as possible to help people. So if you don't like it, well, that's too bad. Then you don't have to watch the video. I'm just here to try to help people because I've watched videos in the past and I've gotten help too from other people about certain things. Not just, I'm not talking about even this, about a lot of things. So I'm trying to give back in my own way from what I've learned. Okay. So, well, I'll kind of start backwards, more so like when she was more bedridden, and then I'll kind of retract or rewind in a way to where like I first started out. But I think I'll cover this because it's more fresh right now concerning when I last took care of her, and plus everything is the way it is, all spread out. And I was able to put together a dummy, like, for the video process to explain to people, like how to treat the patient. But first off, if you need to use things, well, obviously you will need to use things, but you'll need a air mattress, okay? Now, this is a Drive medical air mattress. Now, hospice would make you rent this or whatever on your medical thing, or they would pay for it, but it would be considered renting. But you can actually buy this for $50. Now, again, you can buy it off of Amazon. It's called a Drive Med Air variable pressure pump system. It's an air mattress, okay? Now, see, it's not that big. This, what it will do is inflate your mattress when you take care of the patient, and it will change the air pressures like this, 50-50 in all the individual cells. Now, it's not the end-all be-all. It certainly helps, but it's not the end-all be-all. You will need to do more to help the patient. What you will need to do is to prevent bed sores, and bed sores are the primary concern when you are taking care of the patient to prevent. They are a major issue, and maybe I can post pictures on here to show how much of an issue they are. But they are your primary concern, is to stop bed sores from happening, and that even comes to eating well, and certainly using the right methods and techniques. And little things matter tremendously in this job when you care for your grandmother or whoever. I don't want to intimidate you. It's very possible to do this job. I'm making it seem more complicated than it can be, although all the fine details do matter. Don't be afraid to do it if you want to do it. Just make sure you have the right tools and right methods, and just try to keep your head above water. That's all it is about. Keep their head above water, your head above water. There might not ever be such thing as having a boat or a canoe to float in this job. It's more like treading water, doing the best you can, just living one day to the next, or 2 days to the next, 2 days at a time, or a week at a time, 2 weeks at a time. You just got to get through it the best you can, because ultimately you're doing this out of love to help whoever you are, and it's the love that helps you overcome the tremendous adversity. Just hang in there, don't be intimidated, just do the best you can, but have the tools. All right, this is, like I said, hospice, they won't even give this to you if you have your own bed at home, okay? For example, like I do here, they will not give this to you to let you rent. So that's why it's also good to buy your own. It's $50, give or take, whatever, off of Amazon. It's very useful. Obviously, it's a lifesaver, as are so many other things that are lifesavers. But they will not give it to you unless you have a medical bed, which also I'm personally against having a medical bed, hospital bed, because first off, the surface area is not big enough. And you ideally should have a bigger surface area, because you'll be able to slide the patient around, especially both sides of the bed. Well, you might be able to lower the bed perhaps, but I like a nice lower surface to deal with. As you can see, I'm sitting down. Now look where I put my hand. You see my hand on the other screen. I'm working with the desk below me. You don't want to be working with a desk that's high up, more towards like your chest or above your chest, for example, or your mid chest, like a bed. You want a nice low bed. This is a couch bed, okay? These are very good beds, I consider, to use, because they're nice and low. They do the job, and they have nice cushions in the back, okay, to use. And you'll need a lot of tools, and I'm going to cover all the tools first off, and then I'll start showing techniques to use if you decide to use this method or these methods. Now, the one I just mentioned, the Med-Air burial pressure pump system, that's the first one. You want to keep it all the way down to soft, okay? Soft as can be, because these things, believe it or not, it seems like they're soft, but it can be a little hard. All right, and another thing I want to say is this job is not pretty. Your house could likely be a mess doing this job. There's a lot of junk you'll have, like pillows, a lot of crap you'll have laying around, and you just want to throw things up on like the ledges of the couch and things like that. And you're going to need a lot of towels in this job, and blankets, not only to put on the patient when they're cold, but to support underneath their feet. Okay, so anyways, let me go ahead and plug this in, and I'll show you how it works. It's very simple, $50, and it's a lifesaver, as are many other things in this job. They all kind of work in tandem. Some are bigger players than others, but they're all in tandem. You plug it in, very simple. You can actually hang it on the bed. It has these hooks on there, but I never did. I just used the as the hooks if you need them, but I always used like a little footstool. Okay. All right, and you have this tube. You connect it in there like so. Okay, and there's air that comes out in these locations. You just plug your tubes in, and you should be familiar kind of how the system works, ideally over time. It took me a long time to learn it, but you should be familiar how like the air comes this way one time and it comes that way. It doesn't, I never really noticed the air sucking back out this way, but it comes out that way to fill up the air mattress, and then it's almost like it lets it deflate naturally, and then the other ones goes on. So these are like two air like pumps that shoot outwards. I don't think it ever really sucks back in, because the mattress will naturally deflate, I think, over time, unless I'm wrong about that, but I never really noticed much. But use this here, okay? And I made the dummy here, as you can see. All right, I have a dummy, and it's kind of, they're not connected. Now this white thing right here, these white things will be like the butt cheeks, okay? And but I had to simulate that, as you can see, and that will help talk about the bed sores in a few moments or whatever. I'll put this out of the way. Okay. All right, this is for my cat. All right, I'll get to everything, and what I can't do in one video, perhaps I'll link them all together or do in another video. And I'm going to wear a hat with a camera so you can see another angle, me doing everything here, so you can see firsthand. All right, so you'll see it in a little bit, but you can see here, look, here's the mattress underneath, and this is the same exact one I used for my grandmother. Okay. All right, that's the same one, exact one I used for my grandmother, and you have these little, inlet valves here. Okay, let me maybe put it on my video camera. As you can see right here, I think my hands, yeah, good, very good. All right, now you plug the tubes in, very simple, like this. Okay, this is like your base of taking care of your patient when they get to this critical stage, which is towards the end of their life, more so. And okay, now you just turn it on, this little green thing here, down there. You hear it going on, that's fine, just right. Okay, now to get an idea of, only one side fills up at a time. As you can see, this side here, you pinch it, you know where the air is coming. That's how you know where the air is coming. So it took me a long time to learn all this stuff. I'm trying to save you the learning curve of it all. But what you need to do is, you just let it run its course. It has to fill up both of the half of the cells, 50% each, where the cords run into, the tubes, I mean. So it'll fill up this 50% all the way throughout the mattress, and then the other side will fill up the other 50%. Okay. And you can see I double lap it. That's the only way to go as far as I'm concerned. I don't like doing it singly, because what can happen is if you use it single and you spread it out all the way, first off, you probably have too much slack, like especially going down this way. And then if you turn it like that, you're not going to have enough room going this way. So it's just harder to deal with if you don't double lap it, okay? And well, you just double lap it. Try to kind of stagger it to where the cells don't exactly line up a little bit, That way you get the purpose out of the mattress. So you don't want to have like a cell inflating at the same time as the other one's inflating underneath, and then you're not, or whatever. You want to kind of have something like that. You want to stagnate it, whatever you want to call it. But you can see things are filling up. It's going to take a little while. In the meantime, while it's doing that, I'll show you some of the other things you'll need to do this job. One being, you need a lot of this synthetic wool. Okay? You can see right here. You need a lot of synthetic wool. And one of them you need big enough to you need it big enough to encompass basically the entire air mattress in a way, or pretty close to it, going horizontally and vertically, so that you can slide the patient around. Okay, and it adds more comfort to the patient when they're laying down. All right, so let's see here. You'll need a couple nice big pillows. That comes along with the couch, and that's why I'm against medical hospital beds, because It's just more cushy this way, I think. I mean, if it works for people, good. But for me, I'm all about keeping things simple and using what you have. Ideally, a couch bed or stuff like that. Okay. Let's see here. Yeah, I'll be showing you. Let's see. Okay, I'll show you this. Now, I'll tell you the specifics later. Me and my mother sewed this together here. Okay, you can see our sew marks and how much we actually use this. But, and there's old stains because I told you this job is not pretty. They'll be doing a lot of washing in this job. And basically, what you can do is get 2 of the biggest type of synthetic wools you can buy on Amazon and sew the 2 biggest together right down the middle, and that'll give you exactly the dimensions you need to do this job. And it's something like this, as you can see how it spreads out, you know, from the whole entire air mattress all the way down and even past it. That's about what you need to do the job, because you'll be sliding the patient and you'll lose slack going this way, maybe some slack going upwards when you move the patient around. So you need what they call synthetic wool or sheepskin. Look it up on Amazon, you'll find it. Maybe I can show some links or whatever, or stuff like that. I don't know, I'm not too good at all this. But you'll need this. You can see how it's inflating now. You can see, listen, see the air's coming in this one, as you can see. And if you get too much air in one, all you got to do is switch the tubes around. Okay, you go like this, and that, see, that's something that it took me a while to learn. So that's one thing in the learning curve. See, if you get too much, you get enough air, you want to kind of even things out so it doesn't take forever. Or when you're sliding the patient around, even with the wool on top, you want to get the air deflated about 50% or something like that, because well, it's easier to slide the patient around, and also you don't want to rip, you won't be pulling too much on this mattress, and that's another reason you want inflation in it, and you don't want to deflate it all the way, because you'll be pulling it more. And that's another reason why I told you to double lap it, because if it's single lap, you don't pull 2 things, dragging them over, sliding them over. You will be pulling on one, and you'll likely rip the seams, which I ripped a seam one time. And you have to also be careful you don't get it caught on the side of the bed in the middle parts. So in that case, you want to put a chair or something, prop it up, or have somebody hold it up while you're sliding the patient that way. All that kind of stuff, excuse me. So, and now that it's filling up, as you can see, all the things you'll need, and let me go through them. All right, let's see here. Well, you'll need, Prevail. You don't have, it doesn't have to be this brand, but you can see here, okay, Prevail Perfect, and it's extra absorbency and extra large. I like the extra large. They're not all that big anyways. And you really don't need to put this on the patient, like slip them up their legs. You just need to like stuff it underneath. And a couple of them is best, you know, to use 2 of them. Oh, there, my thing's moving around now. Oh, shucks. All right. Okay, I don't know. As you can see, it's comfort shape with form-fitting elastics, extra absorbency, extra large 14 underwear, Prevail Perfect large underwear, whatever. It's pee underwear. It absorbs the pee, and that's what you need to do. That's one of the major concerns. You have to keep the pee from getting down there. That's what also is a highly thing that causes bed sores. All right. So that's certainly one thing you want to do, is keep pee from happening. And another thing is you need Prevail underpads. Now this is like a bed liner that goes underneath the wool that I just showed you, the synthetic wool. All right. This is a lifesaver too, along with the pee pads. All of it is play their part, but they're all necessary. It's like almost like a car engine. You need everything there to run properly. Okay, this is super absorbent. It's called tin. Has tin in here, tin disposable underpads. They're called underpads, but they really are more like pads than like underwear, and that's what they exactly are, underpads. I call them last line of defense pads because it catches all the pee that happened to slip through the Prevail underwear pads that I'll get to later, and I'll show you more of an example. And as you can see, my house is still a mess from when I took care of my grandmother. It has towels everywhere. You'll need lots of towels to use for wash rags and to wipe up poop and pee and the whole bit, even to treat sores possibly. But let's see here. Okay. See, here's an example of it. Now you want, no, actually I told you put it under the wool, but you want to put it over the wool. You drape it right over the wool on top of it. When you have the patient on the side, you put it under them like that and see how it is. And these are disposable, you throw them away. But you put it on top of the synthetic wool, right directly under the patient. And now everything's starting to fill out nicely, as you can see. All right. And you can carry some of these scraps. You can even buy a little more than the 2. Actually, I would recommend buying at least 4 of those synthetic wools, the biggest ones, and sew each of them 2 together, because you'll need one just in case if there's an accident, if there's poop or anything else. You'll need it to have a replacement right in action when you need it. So it can be costly to do this at your own house, but compared to like being in the hospital or nursing home, it's like a bargain. You know what I mean? So yeah, it's worth it if you can get your money together. And you'll need a lot of pillows too, ideally, because you'll need to do some proppings. 2 nice big ones like I showed you over here. 2 of these real big ones will do the job. And you need some nice big quilts to support their legs, or blankets, and just double fold them, triple fold them, whatever. And so that's the gist of it. You'll need also these gauze pads, as I'll show you when I put the dummy on there. I get these new type, and it says new on there, on Amazon. I order from like Pharma Packs or whatever you call it. Band-Aid, Johnson & Johnson, large gauze pads, quilt vent technology, 25 large sterile pads. Okay, these are large gauze pads, 4 by 4 inch. Okay, now I've always used these. I particularly like these because they're thicker. All right, let me turn this off. Well, I guess it really doesn't matter, but I always turn it off when I'm addressing the patient. But if you weren't to use these and you were to use regular 4 by 4 gauze pads, like the normal type, these are a little thicker, then I would recommend using probably about 6 gauze pads while we do this job, rather than 4 like I'm going to show you. But I'm going to show you the problem areas while doing this job. Let me put the dummy back. Okay, normally, here's the butt. And let's see here. Here's the torso. Normally use something like this, okay? And again, I will show you the techniques while I do this, all right? So you'll have to see, but there's the dummy. And you don't ideally want to sit them up this high. Just close the door over there. You don't want to ideally sit them up this high. Basically, the more you sit them up on an air mattress without, is what I call an air donut, which I'll get to in a little while. The more you sit them up on the air mattress, the more danger it is for their butt to get a bed sore, is what you would call it, okay? Or a bed ulcer, a pressure sore. That's another name for it, all right? So that's what you need for now, okay? Okay, I forgot to put this wool thing on here. And I could tell you the exact dimensions of to buy this synthetic sheep wool, but just buy the biggest one. It's like, I don't remember what it is, 30 by 60 or something. I don't remember. And you got to put two of them together. Nah, maybe I'm way off. You got to put two of them together. I didn't measure it, and I don't feel like doing it just yet because I'm busy. Oh. Okay. Now that thing, I'm gonna have to piece that together. All right, let's see if it's still recording my audio. Okay, but it'll be something more like this, okay? And you have the wool all the way going across, all right? And then it'll be more like that. And you have the torso here. And again, I use air donuts. That's the one great method that I use. And you have the cheeks, okay, buttocks, whatever. Okay, something like that, all right? So, the patient's in bed, you have the mattress going, keep it back on, all right? So now you say, oh, well, it's time for your daily maintenance of your butt, or move you around a little bit, make sure everything's okay. And this is when they're at this critical stage of taking care of the patient. They're on an air mattress, so they're fairly bedridden, or completely bedridden, really. And now you could use this earlier in the stage of a medical treatment, or your caregiving, just in the nights perhaps, and set them up in the days more so. But you can set them up in the days. Even on the air mattress, believe it or not, and that's the method I'm going to show you with an air donut. Okay, these things develop very quickly. These pressure sores or ulcers or bed sores, they develop very quickly. They bruise the area, and to the point to where it gets so red it doesn't recover and it has to open up. And that's what I call cherry blossom, and the cherry blossoms have to open up when it's so red that this is so serious damage or trauma to the butt around the tailbone area. It has to open up, and at that point then you're dealing with the full-fledged bed sore, which I'll show you also a treatment for that method when you're doing this job. Okay. So you got your mattress on, it's working. Look, see, that's nice, and you press this hard and it's deflated some on that side. That's fine. Okay, now ideally you want this about even when you're actually going to slide the patient over. So that's the whole point of like swapping these out. Say if you're getting too much air, you can let a little bit of air out if it's too firm. You don't want it too firm for the patient, and you swap them out. You don't want it too firm. I mean, like when you turn it off and you're dealing with the patient, want it kind of as comfortable as possible. But the reason during the inflation process it gets hard because it gives the other side a break at the other area. Now again, don't expect this to be the end all be all, this air mattress. You're going to use other methods. You're going to have to slide the patient around. Well, you're going to have to set the patient up, let's put it that way. But hospice would, or any medical professional would say, well, you're supposed to move the patient every 2 hours. Okay, now, hey, If you want to go according to their guidelines, that's fine. But if you're willing to, at your own risk, listen to what I'm saying, there is another way. Doing it for 1 day at a time, when you know, even less until you can prove that you know what you're doing in this method. All right, and I use an air donut. Okay, now let me go show you. This is what I use right here, this air donut. Now I set this under her. Now it's not in the traditional manner. You have to fold it like so, flatten it out all the way. Make sure, and you have to have the right amount of air in there. So it's basically something about like this. See about how much air is in there? And you make sure it's kind of all evenly done. And this is even FDA approved to use on patients. Although I wouldn't say the majority of people ever use it in this manner, like where you double fold it, back fold it on each other. And look, here's the thing. You fold it back over that, you know, like a sandwich or something, you know, and just make sure everything's creased out properly. And you want to have not too much air, certainly not too little. Too much air, it'll spit it out. Like when you try to stuff it under, try to wedge it in there, it'll push out because it's too inflated. It won't go underneath. It won't sit underneath enough. Too little air, and then the tailbone could possibly touch the air mattress. And since you're going to use it for such a long period of time, say up to a day. Now, when you use this, keep in mind, one side of the tailbone, one half of the tailbone gets the, sorry, I don't have it up here so you can see me so much. One half of the tailbone gets more trouble than the other, okay? So, generally, at least from my experience, okay? What I'm saying is, generally, at least for my grandmother, and I can't imagine it any different for anybody else, is that one side of the tailbone will get more problems than the other. It will get more prone to being red and possible bed sores. So keep that in mind, learn which side it is. For my grandmother, it was like if her tailbone is like this, see, it was her left side. But it was her left side of her tailbone. Like for example, this is her butt, it's this way. All right, I gotta take a break now. My batteries are running low. We'll